In 1993, the Ministry of Health Malaysia had implemented the Hospital Information System in the healthcare system. This strengthens the application of information technology in the healthcare system. This implementation helps to achieve the aim of the Ministry of Health, which is to help the individual achieve and maintain a standard of health that enables him to lead a productive economic and social life more easier, as it is expected to increase the efficiency of healthcare service. The HIS system includes the system that collects, stores, manages, and transmits a patient's electronic medical record (EMR). So what is EMR? EMR is an electronic record of health-related information on an individual that can be created, gathered, managed, and consulted by authorized clinicians and staff within one healthcare organization. It is a medical record which is stored electronically.
There are a few materials that should be included in the EMR system. In a hospital, the pharmacist, physician, or any other healthcare provider will collect and gather the patient's data in order to insert into the EMR system. So, what information do they need to get from the patient? First, it is identification information. For example, your name, gender, IC number, and home address. Secondly, it is a medical history, which is about patients' allergies, previous or current treatments, medical care, and current or past diagnosis. Thirdly, medication information is also important for documentation because this would affect a patient's course of treatment. For instance, the medications patient had tried, such as herbal remedies and OTC medication. Next, family history such as hereditary disease that may be passed down should be documented. One of the hereditary disease example is G6PD. Not only that, patients' treatment histories and lab test results should be recorded into EMR for doctors or physicians' review.
Now, let's see how EMR is used in healthcare settings. First, when an appointment is requested, then a patient's medical record is accessed through the EMR system. The physician can retrieve the previous EMR or create a new record. In the EMR system, the patient appointment is scheduled. Second, when a patient arrives, the co-payment is collected and insurance is verified. The pre-examination information and record of the prior medical history of patient are entered into the EMR system. Third, when meeting with the physician creates a progress note which includes the history of present illness, review of symptoms, and physical exams as EMR. The device used in this stage includes the utilized desktop, tablets, and microphones with voice activation software. Prescribing medication using EMR can detect and give warnings for allergies and conflicting medication. Fourth, it is time for the patient to check out. Here, EMR is accessed by the front desk to schedule a follow-up visit with the physician and issue a receipt to the patient. Some basic features must include in EMR system. First is the complete security system. A strong and complete security system helps to prevent data leakage and inadvertent misappropriation by criminals and protect the privacy of patients so that their information is always secure. Second is the online training about tutorial on using EMR for the healthcare personnel. Some other extra features of EMR include the customizable EMR templates, EMR that can be accessed 24/7, enables the sharing of information between physicians, scheduling features that include notification function as well as e-prescriptions.
There is no doubt that EMR helps increase efficiency and lower the cost of modern medicine. So, how does it reduce costs in hospitals? First, it helps to reduce office supplies expenses. EMR software allow paperless workflows. The truth is that EMR do not completely eliminate the usage of paper. However, an EMR can greatly minimize the requirement of paper, lowering monthly hard costs and freeing up funds for other purposes. Another line of thought is to increase productivity. Not to mention, learning to use an EMR software is time-consuming and will almost likely to slow down the clinician initially. However, productivity will gradually grow as learning takes place. For example, documenting patient visits and carrying out billing processes will take less time if physicians and employees utilize an EMR. This enables doctors to spend more time with patients and increase productivity. Not to mention, EMRs helps in obtaining additional office space. When EMR has been utilized, the paper-based documents will be reduced and free up more space for other purposes. For instance, the free space or room can be made into a ward so that the hospital can serve more patients in order to increase their productivity. The last point is EMR aids in the more efficient allocation of staff resources. The most obvious way that an EMR system can help save money on staff is by eliminating the requirement for a full-time medical records clerk, and then make better use of them. For example, a file clerk can be trained to do front desk chores, decreasing burden and minimizing overtime for other staff without having to hire extra staff. Thus, what are the paybacks of EMR? The primary purpose of EMR is to collect and transmit basic demographic and clinical health data. This refers to patient-specific information, such as a patient's identifications and clinical participations, or encounter details. Most common data such as allergies, lab test results, vital signs, weight, body height, BMR, and to name a few. Next, the clinical decision support is the other function. EMR system must trigger an alert for clinicians by sounding a warning if a non-allergic medicine is prescribed or a non-drug interaction is possible. Then, provide a recommended treatment. This function is able to reduce therapeutic error and ensure safety and effectiveness of the drugs to be administered to the patients by minimizing the drug adverse reactions and maximizing the drug's effectiveness according to patients' personal conditions. Order entry and electronic prescriptions are the third function. Doctor can use EMR systems to enter orders with all the necessary information. For instance, manage vaccines by recording the dose and entering the locations, and manage reference orders by entering information about the referring and reference providers. The fourth function is to ensure that the medical records of patients are kept safe, secure, and secret. To safeguard the privacy of data, any EMR system must have health security and confidentiality. Everyone can only access certain types of data and functionality based on his or her role.
EMR in turn has its limitations. First, the usage of EMR increases the workload of healthcare personnel. The physicians have more virtual work to do, which causes them have less time to interact with the patient. They spend more time in front of the screen to input the data and information into EMR system instead of with the patients. Next, EMR causes workflow frustrations, especially when the physicians need to share the patient's record with another provider who does not have access to the same EMR system. This has led to workarounds that can create confusions, potential errors, and risk to HIPAA compliance. Other limitation is the security risk. As all patients' data and information is kept in the EMR system, there is a high risk to be exposed to the data leakage or being hacked. The crisis may also be exacerbated by the use of multiple network devices. In order to increase the effectiveness of EMR, improvement is necessary. We can streamline the document completion. For example, the medical forms which require repeatedly writing demographic information are stored in the EMR system, which can be directly scanned and taken from the system. Next, considering going mobile could be a good idea. The physician can use the mobile apps easier, especially when they are on ward round. Bringing a tablet or smartphone which have installed the EMR system alone can save the time for walking back and forth to a specific computer. Lastly, it is recommended that the EMR system should consist of minimal typing requirements, as people type at different speeds, which can significantly reduce the efficiency of use. Avoiding typing will also reduce the possible typing error occurs.
In summary, each EMR is a collection of data concerning a single patient that contains information generated as the result of clinical patient care. The data is documented by healthcare professionals who are taking care of the patient. EMR is a useful system to communicate with doctors and for patients to monitor their health as well as keep track of their medical results. EMR provides a variety of services to assist patients along their path. It keeps track of their appointments, medical records, and online counseling for various hospitals. It also assists caregivers to expand, improve, and regulate their daily tasks. All patients, hospitals, and medical labs benefit from this since it saves time and efforts.